Food allergies can be super confusing, and for a lot of parents, they're honestly pretty scary. So in this explainer, we're going to break it all down, what's really happening in your body, how to spot the signs, and what you can do to manage them. Let's dive right in.
All right, let's kick things off with a number that, well, it might actually surprise you. 1 in every 10 babies has a food allergy. That's a pretty big deal. It just goes to show how common this is, right from the very beginning of life, which is exactly why it's so important for all of us to get a handle on this.
Okay, so to really wrap our heads around this, we've got to start with the basics. What in the world is actually going on inside the body when someone has an allergic reaction? The easiest way to think about it is like a false alarm. Your body's security system is going off when it really doesn't need to. So here's the absolute key thing to remember. This is your immune system we're talking about. This isn't just a bit of an upset stomach. It's your body's defense system getting confused. It sees something totally harmless, like a protein in a peanut, and for some reason it flags it as a dangerous invader, and then it launches this massive attack. And that's what causes a reaction that can affect everything from your skin to your breathing.
So what foods are the usual suspects here? Well, this list covers the big ones. Now, the good news is a lot of kids will actually outgrow allergies to things like milk, eggs, or wheat. But things like peanut, tree nut, and seafood allergies, yeah, those tend to stick around for life.
Okay, let's get to what is maybe the most important part of this whole thing, recognizing the signs. Seriously, knowing what to look for can be the difference between a little bit of discomfort and a full-blown medical emergency.
So you got to understand, allergic reactions aren't all the same. They're on a spectrum. On one end, you might see milder things like hives or some tummy pain. But on the other end, there's anaphylaxis. You really need to pay close attention to these severe signs. If you see any swelling of the tongue, if they mention a tightness in their throat, if there's any trouble breathing, or if they feel dizzy. Those are massive red flags for a life-threatening emergency.
And look, let me be crystal clear about this. If you see any of those severe symptoms, you don't wait. You don't wonder. The very first and most important thing you do is call for an ambulance. Immediately. All right, let's clear something up, because this is a big one. People throw around the words allergy and intolerance like they're the same thing. But medically speaking, they are not. Not even close.
Here's the simple breakdown. A food allergy involves your immune system, and as we've said, it can be life-threatening. A food intolerance is all about your digestive system. It's not fun, for sure. It can cause things like bloating and diarrhea, but it's not going to trigger that life-threatening anaphylaxis. Okay, so what if you think you or your child might have a food allergy? What do? Well, the good news is you don't have to live in that what-if world of guessing. There's a clear, science-based path that doctors follow to get you a real answer.
It all starts with a simple chat with your doctor. You'll go over your history, talk about the symptoms you've seen, that kind of thing. From there, your doctor can set up specific tests that literally measure your immune system's reaction to different foods. That's how they can confirm exactly what the trigger is.
A specialist is going to use real evidence-based tests like these to figure things out. Things like skin prick tests and blood tests are looking for something very specific called immunoglobulin E, or IgE. Just think of IgE as the little attack flags your immune system raises for a specific allergen. By measuring these, a doctor can pinpoint exactly what's causing the problem and give you a proper diagnosis.
So, getting that diagnosis, that's step 1. But step 2 is all about empowerment, learning how to manage it. So let's talk about the action plan for living a safe and confident life with the food allergy.
Look, managing a food allergy really comes down to being proactive and prepared. It means you become an expert at reading food labels. You get really good at telling people about your allergy when you're eating out. You're careful about cross-contamination in the kitchen. And listen, if there's any risk of anaphylaxis, there are 2 things that are completely non-negotiable. You always carry your adrenaline auto-injector, and you have a clear written action plan ready to go.
And all of this brings us to a final, bigger question. We've talked about what an allergy is and how to manage it one-on-one. But with allergies becoming more and more common, this isn't just about individual management anymore. The responsibility kind of spreads to all of us. So how can we, as a whole community, make our schools, our restaurants, and just our get-togethers safer for everybody? It's definitely something worth thinking about. Thanks so much for joining me.